If you have topics you would like to have us discuss on the Aging Well podcast, please click on the links in the episode description to send us a text or record your message or comments. We'd love to hear from you and how we can help you age well. If you benefit from the Aging Well podcast and would like to support the content financially, please click on the Support the Show link or support our affiliates and advertisers. Welcome to the Aging Well podcast. I'm Jeff Armstrong here with Corbin Bruton. In this and the episodes that follow, we will share candid discussions on aging and hear from the experts. We are here to inform and encourage as we experience, aging. In this episode, Dr. Armstrong is joined by Dr. Rob Winningham to discuss memory and cognitive function with aging. Dr. Winningham is a professor of psychology and gerontology at Western Oregon University and currently serves as the provost and vice president for academic affairs. His scholarship focused on memory and aging for the past 30 years. He is the author of Train Your Brain, How to Maximize Memory Ability in Older Adulthood, and Cranium Crunches, both of which can be found on Amazon. As we often say regarding human performance, with brain function and risk of dementia, choose your parents wisely. In addition to heredity, we discuss epigenetics, diet, exercise, and the other lifestyle behaviors that can affect one's memory and cognitive function as they age, the risk of dementia, and onset of dementia as we seek to age well. So, Dr. Winningham, welcome to the Aging Well podcast. I'm kind of not used to interacting with you in this role, and I almost actually forgot that you were, a psychology professor and a neuroscientist, since you've been acting in the role of provost, but I know you're still very active in research. And it's been a little bit of time since I think we've really talked about your research and some of the things that you do. And so, this being a podcast on aging well, I thought it would be really nice to have you on the podcast to talk a little bit more about your research in dementia and some of the different things that you've been doing to examine that and what we can do to, whether it's to minimize the risk, avoid the risk, or to deal with it when it inevitably occurs. And so let's kind of just start with you telling us a little bit about your background.
Yeah, so I was trained as a cognitive psychologist. Then I did my PhD in neuroscience. And so my research has always been related to human memory and with a deep understanding of neuroscience and neuropsychology. I got my start in this field of human memory 30 years ago, trying to implant false childhood memories into college students. And so that was kind of a hot topic in the early 90s, and we were really much in that field. And there were legislative changes because of that work and whatnot in the early 90s. Then I started doing research in eyewitness memory, how people remember crime scenes. But most of that good work was done. So my dissertation was how older adults remember crime scenes, how do they perform as eyewitnesses, which just afforded me the opportunity for an entire year to focus on older adults and memory. And that just was where my career launched. And when I became an assistant professor, did a lot of research on cognitive stimulation, the effects of cognitive stimulation, particularly for people who have mild cognitive impairment already and possibly living in an assisted living environment. And so did a lot of work in that area, still do. And then just spending the time in assisted living communities, you saw there was so much room for improvement, and kind of juxtapose that where we knew everything about nothing almost, in the eyewitness memory realm. It was just really refreshing. And so we did research on looking at the effects of nutrition on memory. We looked at the effects of social engagement and loneliness and seeing if we can affect that. And then I spent over a decade of my career just developing resources, materials, hardware, software to help improve older adults' quality of life, largely in a retirement community setting. And that work now, so 20,000 retirement communities use the materials I've created in terms of cognitive stimulation, and thousands of them have access to the software that I've worked with others on. So it's been quite a journey over the past 30 years working in this field.
Sounds exciting. And I know we've talked a lot on campus about kind of the interactions between our disciplines. And you're kind of overseeing, I mean, not only now the university, but in the psychology department, you kind of oversaw both psychology and gerontology. And I'm over in the exercise science end. And I think we all have those connections. And part of the role of this podcast is really to draw in all those areas of both the physiological, the spiritual, the emotional, the intellectual, and the social aspects of how we can age well. And we've kind of always considered on the podcast that aging well begins at birth, maybe even before birth, when you start jumping into epigenetics and some of those types of things. And so not only just with the elderly and those who are already kind of in elder care type of situations, what can we do to improve our memory? I mean, I probably still need this as a professor to remember a little bit more like student names and things like that. But having teenagers, getting them to remember things better for school. How do we improve memory ability?
I want to start with a comment to what you said. I mean, you're absolutely right that a lot of this does begin before birth, and the epigenetic research is fascinating. But even just from a genetic standpoint, it's about 50% of our memory ability, 50% of our chance of developing dementia, and 50% of how happy we are is related to how well we chose our parents. Right. And so, and that, and there's people make careers out of arguing, is it 45, 50, or 55% in the context of dementia? And then looking at, we always talk about Alzheimer's as being, almost synonymous with dementia. And of course it's not, but you look at the dozens of types of dementia and they have varying inputs and relationship to the heritability. So, so the genetics is critical. But after that, the things that we can do, a big part of it, and I kind of look at this as short term and long term. Short term, in the moment, we've known these techniques for quite some time, and they often stem back to paying attention, really giving it the focus that's needed. We don't want to multitask. We don't want to be thinking about something else, and so that's kind of critical. So there's a whole body of research that people are familiar with on mnemonics and things like that. I think your question might be getting at more some of the long-term effects, and there are numerous behavioral and lifestyle findings that are related to our memory ability and our chance of developing dementia. The one that, this is, largely in your field, right? But there are more studies from my read on this, looking at the effects of physical exercise on dementia than any other lifestyle variable. Just hundreds of these studies, and I'd love to, maybe in a follow-up question, we kind of poke at these a little bit. And that research, I think, is still developing really well. So that's a big one. Then after that, I would talk about cognitive exercise, and that's one that I have focused a lot on, and the research there is robust. It's difficult research to do because it's largely correlational, but there are an increasing number of randomized controlled studies showing that we can improve people's ability to make new memories. That could delay dementia, and we estimate if we can delay the onset of dementia by 4 years, that will cut the incidence in half because it's such a late life disease. So delaying dementia is great. That has some huge effects. Beyond that, and I think this is somewhat related to both physical and the cognitive stimulation, but I've been really interested in the research on yoga, meditation, Tai Chi, and what they all find. So, and this is, I wish I would have known this 25 years ago. I would have done things a little differently, but over the past 25 years, we've really focused on executive functioning. So it's a frontal lobe activity, our ability to pay attention, concentrate, inhibit, problem solve. That's what this all comes down to. Physical exercise improves our executive functioning. And then we're now finding meditation, yoga, Tai Chi does as well. And if you think about it, doing something like meditation, trying to inhibit outside thoughts, staying focused on, whatever you're doing, if it's a body scan, if it's your breath, if it's some sort of inspirational meditation, you try to have that sustained focus. And that is what we have found works best in the field of cognitive stimulation. I'm just really struck at the similarity between meditation, mindfulness training, and the cognitive stimulation. So that's been shown to improve executive functioning as well. And then if you think about it, yoga is actually sort of both. I mean, yoga is almost dual tasking, right? Depending on how you're doing it, you're paying attention to your body, often connecting that to your breath. So you're doing a physical activity, and that could be strength training, that could be aerobic, that could be flexibility, all of which probably have a different physiological input into the finding related to cognition. So I think those are some of them. And then all the things we want to avoid. You want to avoid depression, anxiety. You want to avoid diabetes. So there are a lot of, you want to avoid neurodegenerative diseases. You want to avoid vascular diseases. And all of those can have a profound impact on our memory ability and chance of developing dementia as well.
I discussed my epigenetics test with True Diagnostic co-founder Hannah Wendt in episode 162. Epigenetic testing measures baseline and changes in your pace of aging, giving you the power to steer your anti-aging or health and wellness journey in the right direction. I learned that I am aging well. Click on the affiliate link in the episode description, use the promo code AGEWELL, and receive a 12% discount on your epigenetics test and monitor your pace of aging. So with that, I mean, as you know, I teach a pathophysiology and exercise class. And, one of the things that I have concluded after teaching at both at Eastern Michigan and now again over the last, I think it's been 5 years at Western Oregon University, is that if we really want to improve longevity, and I think I would speculate without doing any kind of research into it, that if we want to eliminate the risk of, or at least minimize the risk of dementia and kind of cognitive decline as we age, same things are going to apply. We want to not smoke. We want to have an adequate diet, healthy diet, adequate body composition, and regular physical activity and exercise. I've concluded that across the board in almost any disease, if you want to minimize the risk, those are the 4 things that you need to do. And it sounds kind of like that would be the case with dementia.
Yeah, I mean, you summarize hundreds of studies there. I mean, those are the things. The physical exercise is huge, and and these are hard because these interact. Because that physical exercise, be it strength training or resistance training, aerobic training, dual tasking, HIIT, that also reduces our chance of other disease processes that affect our cognitive ability. It isn't necessarily the exercise is improving, our memory, but if we avoid a chance of having a stroke, that's actually the second most common cause of dementia. It can happen really quickly. So there's a lot of interaction between these lifestyle variables and other outcomes.
And that kind of brings me to another thing that has popped up a lot is I've been considering like COVID over the last 2 years and looking at the role of exercise, body composition. We learn in exercise physiology that, I teach this thing called Neiman's J, which is this J-shaped curve relating exercise to the risk of upper respiratory tract infection. And what we find is that a sedentary individual has an average risk of an upper respiratory tract infection. If you're doing moderate regular exercise, it significantly decreases that risk. If we increase the intensity and the duration of exercise, it actually begins to increase the risk of upper respiratory tract infection because it fatigues the body. It puts the body in a more vulnerable situation. There's the window of opportunity for viruses to get into the body. And so I've always been kind of fascinated with that. And then in looking at how exercise impacted COVID and how obesity impacted COVID, repeatedly, I would see these inverted J shapes occurring where it wasn't it was a certain like more moderate body composition that improved the risk. It was moderate exercise. Everything was much more in moderation. And when we get to those extreme levels, like I had a friend who, argued back and forth with me about the role of exercise in minimizing the risk of COVID. And, she used as an example, a friend of hers daughter was a collegiate swimmer. and she got COVID. And so it wasn't a matter of just being healthy and exercising. I was like, whoa, wait a minute. That's exactly what I would expect, because a college swimmer is going to be under a lot of stress. They have academics plus their sport. They're training very intensely. Most college students are not getting adequate nutrition, adequate sleep. They're exposed to more viruses. And so that increased that risk of sickness. And as I look at other aspects of the role of exercise, that J keeps coming back. And I wonder, do you see kind of a similar thing where it's more the moderation? It's if we're exercising too intensely, that doesn't necessarily increase the risk, but it less diminishes the risk. Or if we're too sedentary, we have an increased risk. But when we're doing those things in moderation, it has a much better effect. Do you see any of that in your research?
I don't, and I wasn't aware of that U-shaped function in terms of exercise and chance of a respiratory illness. I'm actually seeing. I don't know if this is completely contradictory, but we actually see in the HIIT training, the high intensity interval training, that does seem to actually have some other independent benefits. There's even some brain derived neurotrophic factors that are released if you engage in more of that. But I think that the literature there in with older adults is really limited. It's hard enough to get them to participate in an intervention study, particularly if we're going to try to get some randomized components of it. We have people that are willing to start a program, and then we waitlist them so they're our control. And you have people that are willing to start, but then we do the intervention. It's just hard enough to get them to stick with that for a period of time and with the appropriate intensity. So I haven't seen that, but that's really interesting.
What about stress? How does stress affect memory?
Yeah, stress should have been on my list there at the beginning, because stress does have both short term and long term. One thing that we've all experienced with short term stress is something we call in cognitive psychology displacement. So if you're really stressed trying to do something, you're paying attention to that, but you have a lot of stress. Those stressful ideas can come in and push out whatever we're trying to work on. And we call this our working memory. It used to be called short-term memory. It doesn't hold very much, a sentence worth of information, maybe 7 numbers. And that stress, those stressful thoughts can push out what you're trying to do. So that can have an impact. The long term, we see it has an impact as well. And that's possibly through the stress hormone cortisol. We know that cortisol is hard on the body. It causes you to retain fat. It can impair your immune functioning, but it's also really hard on our cells and could even exasperate cell division, leading to the maximum number of times a cell can divide. So when we look at it over the long haul. And when we look at the personality variables that affect your chance of dementia, stress is the one that pops. And we call it neuroticism. It means prone to distress and worry. But of all personality traits that we measure, that has been most reliably associated with dementia. So people that are just white knuckling it through life do have some increased chance of developing dementia, possibly through the cortisol pathway, which could lead to greater cell division. But it could be through some other inflammatory processes as well. So it's interesting to note the short and long-term effects of stress. So maybe that's another benefit of yoga, meditation. Maybe it's another benefit of physical exercise in general. We certainly see the relationship between physical exercise, mood, and depression, although, usually most studies find that effect. So that might be moderating that correlation as well.
Yeah, and I can see that kind of fitting again with that inverted J, or the J shape as well, where we're not excessively stressing about. We need a certain amount of stress for adaptation and for growth and for, prompting us to do things. But too much stress is beginning to, again, like you said, the cortisol works with the exercise as well. If we're doing too much exercise and it too often at too high of an intensity, it's going to keep us in a more catabolic state because of the cortisol, as opposed to a more anabolic state. So I think there's a lot of interesting stuff. We could probably go on for hours in terms of that, and probably need to connect a lot more across campus with some of your colleagues to see what we can do research wise. Because you're right, there is a little bit of a paucity in the research in those areas. Um,
There's a classic relationship. It's actually an inverted U relationship. It's called the Yerkes-Dodson law in psychology. A little different than what we were just talking about. But as stress levels increase on the y-axis, if stress is really low, we don't do so well cognitively. But if stress gets a little higher, the medium point, that's when we do the best. But if stress continues, our performance goes back down again. So yeah, we see that function all over the place when it comes to stress.
Yeah, it's that kind of inverted U. And I think, again, with the J and the U, they both kind of match up, but they're the apex, and I always forget what to call the valley. The peak and the valley are generally going to be probably in about the same zone of activity or stress levels and those types of things.
Yeah.
One of the things that prompted me to invite you on the podcast was seeing an article that I think was linked on LinkedIn, where you're talking about the kind of role of multitasking in dementia. And so is multitasking good or bad for one's memory ability?
So I probably should start with defining that. So multitasking is doing two cognitive activities at the same time. Be like trying to listen to me, respond, ask the next question while looking at your phone. If a text comes in, that multitasking, you're checking your text, listening to me at the same time, two cognitive tasks. It's terrible on memory because we can't do two things at once, right? And the research on this shows that you might be able to get a little bit better, in a particular context. If if you do more of these interviews, you kind of have a standard format to it, and you're really quick, and your phone just tells you yes or no, and you can respond real quickly. We can get a little better, but it takes time, and it increases the number of errors that we are likely to make in that type of multitasking. So in general, it's bad. And I know some people are really proud of their multitasking ability. Like, I can multitask. I hear this, and I don't want to hear that, because particularly if they know it's bad and they still do it, that shows a lack of inhibitory abilities, that they can't ignore their phone. The text comes in, even though they're doing something important, but they still look at it. From a prognosis standpoint, I would say that person is either just doesn't care, or it's a sign that they are having some executive functioning challenges already, and that they can't inhibit. So that's one. But then I want to contrast that with dual tasking. I don't know if this is if you've seen this research begin to come out. It's an area that I've been following a lot lately. Dual tasking is doing a cognitive task and a physical task at the same time. And there's a lot of things it could be doing. I mean, even just, I love doing walking meetings. And so I'm walking, I'm talking. I usually have a printed out agenda. I sometimes even make some notes. And that is dual tasking, because we have a physical activity and a cognitive activity. And we got to monitor our safety. And, I need to think about, where are we going, or it doesn't have a sidewalk here. So dual tasking is turning out to be really good, or dual task training is turning out to be really effective. And when we do it with older adults, we find that dual task interventions, where we mix a physical and a cognitive, and sometimes they're coordinated. We'll have people walk, and then they have to look into a grocery bag and grab different colors of tennis balls out while they walk. We got a pink tennis ball, a green one, a yellow one, or they have different numbers on it, and they have to do that while they walk. That's been shown to actually be better than cognitive training alone, which has a significant moderate effect, or physical exercise training alone. And we have brain imaging studies showing that the frontal lobe is more efficient, and mostly executive functioning improves, which is wonderful. Whenever we get that executive functioning to improve, it usually generalizes or transfers to areas we've never trained. That's critical for making some real world gain. So multitasking bad, dual tasking might actually be good for the brain.
That sounds really interesting. And again, a wide open area for our branches of sciences to kind of work together.
And this is one where, we're doing some work now, and we do a lot of work with dual task training, mixing the physical and cognitive. I work with SmartFit. So they have these large boards where we do cognitive exercises on the large boards. You can throw a basketball at it, you can hit it, you can box with it, lights up. You have to do various activities, and a lot of them are just kind of neuropsych activities that we've turned into, we've gamified them. And so we do that with older adults, but we're also doing that with people in the military. So we can stress out, a soldier, and they're stressed for whatever reason. There could be, so an environment is created to induce stress, or it could just be they're coming back from a 10-mile run. And then we want them to do a physical and a cognitive activity at the same time. And the beauty of this is we can actually measure how much their performance decreases when they're dual tasking. So imagine this. We have them do cognitive only. And so it might just be something for an older adult, really simple. On the board, they have to just count by threes. And so they see a 3, they have to tap it. Then they see then a whole bunch of changes, a bunch of numbers up, they got to tap the 6. A bunch of numbers up, they got to tap the 9. Cognitive only. Then we can have them do a physical. It might be how many times can you do a sit to stand? Just some physical activity for 2 minutes. And then we have them do both. And most people will perform more poorly on the cognitive, which is me on my walks. When I'm walking and I'm really into something, I know sometimes I'll even stop, and the person I'm having a meeting with has to stop, and I have to write something down, or we really get into a deep discussion, and we might slow down our pace of walking, right? So, but either the cognitive or the physical will slow down, perform worse. And that difference between the single task performance and the dual task performance has been called dual task cost. And so we can use that to predict the chance that a soldier is going to have problems under stress, but we also can do that to predict the chance of a fall for an older adult who's rehabilitating, working with a physical therapist. We can see how safe they are when we mix both of those. Compared to 10 years ago, in the PT clinic, we'd have them stand up, walk 12 feet, turn around, come back, sit down, a timed up and go. But that doesn't actually predict your chance of falling until you add a cognitive thing in, until you ask her to look inside her purse or dial a phone number. And you're going to see how safe that individual really is when you dual task.
Interesting. When I had my sports performance training facility, we did a lot with visual occlusion training. Nike at the time had their Nike Vapor Strobes, where you could vary the rate at which visual input was coming into the brain. And we would do stuff with either balance activities or following, like with the wrestlers I like to do, where they would have to track. We didn't have the fancy kind of kiosk screen that Nike was promising at the time, but we would just use a laser pointer, and I'd flash it, and they'd have to kind of be in their athletic position and tap and follow that. And then when you take that visual stimulus away, their ability to perform that activity dramatically improved, because they were training the brain basically to require less visual input in order to make the decisions. Like when, catching a ball, they didn't have to track the ball the entire time. And so now the brain could begin to, once the glasses were off, they could use more of that brain power to view the things that were going on around them. And I had always wanted to kind of step that into working with the older population, because we did certain plyometric coordination kind of drills. And I felt with the older population doing that, at an appropriate rate, but kind of regulating that amount of audio or rather the visual input that they would need, we can help minimize the risk of falling.
There's a lot there. And one of the things we do with working with people after brain injury is we actually load more. So they're doing a physical task, and it might just be walking. So they're really at a high fall risk. We put them in a weight supported treadmill, let's say, so they can they're safe, and we have them walk. If we add a cognitive component to that, we dual task them, it actually automatizes a new behavior more quickly. Like when you do something, we try to figure out what this number is, but you do something 100, 150 times, it becomes automatized. It goes more into your cerebellum, and that's where the motor program largely is. It appears that it's called the basal ganglial push, that we can actually make a behavior automatic quicker, which is going to make them safer because they're not going to need to use cognitive resources. Because it's like using a quad cane. They never used a quad cane before, and if we actually dual task them, the use of the quad cane, where to put it down without thinking about it, comes more rapidly. So I think that might be similar to what you were doing with the
Mm-hmm.
athletes.
Yeah. Let me think. What else do I have here to ask you? I have a list of questions here. I'm probably not going to ask all of them just for the kind of sake of time and kind of the direction we're going. But a couple of them kind of relate to the role of drugs and pharmaceuticals in memory ability and dealing with memory ability. I'm not a huge fan of pharmaceuticals. I'm as an exercise physiologist, and as I mentioned with the pathophysiology, I like to kind of work the physiological, the intellectual, and those aspects first, and then drugs is kind of a secondary. But and certainly there's cases where it's an almost immediate need. But can you discuss a little bit about what drugs are available to help people with memory problems, how we can utilize them, how they should best be used, and are there better alternatives to those drugs for individuals?
Yeah, well, I'll start even kind of higher level, and I agree with you. I think many times this is something we need to be really careful of. I mean, there's just a lot of examples. It's like a sleeping medication, for example. It is going to help that person fall asleep. A modern benzodiazepine, but then it's going to become habit forming. If they go off the drug, they're actually going to have worse sleep problems than they did before, and so we see these effects over and over again. So there really is no magic pill. In terms of, before I get to kind of some of the memory enhancing drugs, the one thing to look at is that drugs that make us sleepy usually are not so good for memory. So even something like Benadryl, for example, and the active ingredient Benadryl is used in some sleep aid, that has a high, it affects our acetylcholine system. And so we actually, there's these drugs, you can actually look it up. It's called, I think it's a free PDF you can find nurses use on the internet. It's called the cholinergic burden scale. So a lot of commonly used medication like Benadryl, even like some antihistamine medication that's used for the stomach, some modern medication, has a fairly heavy acetylcholine burden. Acetylcholine is what we use for memory. It's the neurotransmitter that's really important for memory. So you have to watch out for that, and I think the cholinergic burden scale is really important, and because we see that people even taking some over the counter drugs are more likely to have some problems. But in terms of drugs that help memory, I mean, I get a lot of questions about this, and there really are not a lot of good alternatives out there. And I think it's really disappointing when I talk to older adults about memory, because they're getting it. They're being advertised, supplements, medications, things that can enhance memory. And, you can do that. I mean, even just caffeine can enhance memory in the short term, but it comes at a cost. You're going to have a decrease in cognitive ability a few hours after a large dose of caffeine. We see that with a number of stimulants. Fortunately, there are a handful of medications for people that have cognitive impairment. They're called acetylcholine esterase inhibitors is one type. So the neurotransmitter acetylcholine is released, important for memory. And then we have enzymes that go up and eat up our acetylcholine. And so those enzymes will break it down, and then it gets recycled back into the cell. So the enzyme that breaks down this really important neurotransmitter for memory is called acetylcholine esterase. And then so we have drugs that can inhibit that enzyme, acetylcholine esterase inhibitors. So Aricept is probably the most commonly prescribed one in the United States. And it helps people for a period of time. Sometimes there's a pressure to keep them on it longer than they probably need it. And it does have side effects. So the other thing that acetylcholine does is that's important with your muscles. It's important with your GI. So they often will have some GI distress with these drugs. But we're getting better. We use patches now, so we have a more even dose as opposed to a bolus dose, and then they're down. But these acetylcholine esterase inhibitors seem to help. And there are some other drugs that work inside the cells, and some physicians will combine them with acetylcholine esterase inhibitor. It'll give you, the estimates vary, but 6 months, a year, possibly 2 years of memory improvement, and then most people go back to where they would have been without it. But that bump for a year or two potentially is priceless for these people's quality of life, um, and so that's good. And the only thing is you got to figure out the right time to start it. You have to figure out if it is going to help, because not all types of dementias will respond to it similarly. But that one is good news. And then there's other drugs that could work on other systems. I mentioned diabetes, even insulin resistance just wreaks havoc on executive functioning, puts people at risk of cognitive impairment. So medications that we can use to help control blood sugar can also have some indirect effects. So those are probably the top ways that I would view looking at pharmaceuticals and memory.
Now, have you come across any supplements that have shown promise?
Well, we did some research on omega-3 fatty acids years ago, and so there's some evidence that the people that eat more fish, there's some evidence that people that will do an omega-3 fatty acid fish oil works the best supplement are better off. Once again, though, that sounds really safe, but you do have to be careful, because the large doses of omega-3s actually have not an oxidative effect, but a peroxidative effect. And so large doses could actually be harmful, but it seems like it wouldn't be because it seems so natural. But there's research on that. It might also increase the chance of prostate cancer in men a little bit. There's been some studies on that. But so primarily the omega-3s were the area where I'd say they've probably been the most. But there's also the possibility of looking for where there's been some deficits. And the ones you really have to watch out for when you look in older adulthood and cognition are the various vitamin Bs. So few of the dozens of types of dementias are actually related to low vitamin B levels. Folic acid, for example, so B6, B12. And the problem with that is, as we get older, some changes in our pH in our gut, we don't absorb the vitamin Bs as well. And so that's why many older adults, and it could be depending on the age, because it gets worse the older we get, we'll get vitamin B supplements in shots. So we bypass the GI system, that pH barrier there. And that, it won't reverse, the cognitive impairment. But if you have a dementia related to vitamin B impairment, we can stop it. And so that's really good. It was also related to what happens when people develop dementia from drinking. So there's a type of dementia called Korsakoff's, which is actually caused by a vitamin B deficiency. And because of the alcohol, the large caloric intake of alcohol, and then changes in the pH, the vitamin Bs aren't absorbed. And that actually leads to one of our types of dementia. So we've known about that one for 100 years.
So it sounds like even diet can be an important aspect in offsetting it. Do you have any experience with like particular diet parameters that we should be looking at to?
You see the Mediterranean diet pops, and people, it's one of those where I think a lot of people are looking for the Mediterranean diet to pop and be correlated with dementia. And, so if you're looking for less than a 5% chance that you found that difference by chance, and we're only reporting 1 in 20 studies, then we might have a problem there with family-wise error. But the Mediterranean diet's been the one that pops the most. One of the ways that I'm really confident that there's a real effect on the diet is if you do things to reduce cardiovascular risk factors. Given that vascular dementia is so prevalent, and it can be really quick too, or it can be a series of minor ischemic events. Anything we do from a nutrition standpoint or a lifestyle standpoint to reduce cardiovascular risk factors is going to have an impact in the long run on memory as well.
So again, going back to don't smoke, eat a healthy diet, maintain a healthy body weight, and regular physical activity and exercise.
That's right.
So we can solve all the world's problems in those 4 things, I think. But along with doing things like journaling and stress management, and the other things that we could do to kind of be a little bit more healthier psychologically, emotionally, and so on.
Right.
What about crossword puzzles and games that are supposed to keep the mind sharp? How do those impact, or how do those work in terms of reducing our risk of dementia and cognitive decline as we age?
Yeah, that's a great question. A lot of people want to do that. They want to do everything they can to maximize their quality of life. And a lot of people have heard about crossword puzzles. Ironically, crossword puzzles don't work. Cognitive stimulation does, but crossword puzzles don't. Because if you think about it, what do we do with a crossword puzzle? We retrieve previously made memories. We get a cue and we go back in the past, and memories we had made in the past, we retrieve them. You can actually have mid-stage dementia and retrieve previously made memories pretty well. Late stage dementia, you might lose that, but early to mid stage dementia is not the problem of retrieving old memories that you have stored. It's a problem paying attention and making new memories. And that's what the research shows on cognitive stimulation. When we exercise executive functioning, so attention, inhibition, problem solving, reasoning, but particularly attention, when we exercise that, that's when we see and we improve our ability to pay attention. That's when we see improvements to our ability to make new memories, and that's when we see our chance of delaying dementia. So crossword puzzle is actually the wrong type of thing. It's not going to hurt, and I always knew that was going to be the case. But then somebody did a study, and they showed that that was the case. Crossword puzzles didn't help, but something like Sudoku does. So with Sudoku, you can't rely on too many previously made memories. You can get better at it just with practice, but you need to be focusing on, numbers 1 through 9, every row, column, and you might have some sort of strategy. It's very focused. You can't, multitask and do well in a hard Sudoku. And so it's those things that require a lot of attention that do have an impact. And we've known this for a while in this field. And there's some good software products out there, and the ones that exercise attention and executive functioning, they can lead to improvements in our ability to make new memories.
So should I jump on the Wordle craze?
My wife and I do it every morning. I got it in 3 this morning. She got it in 5. Usually that's reversed, but it wouldn't hurt. It certainly has been included in studies because we've done things like that. We have the jumbo word finds or the anagrams that you have to get the letters in. Those types of things have been included in studies that show there's an effect. I don't think it's a huge effect, but it also depends on how you do it. So if you do the Wordle where you're trying to come up with 5 letters, get them in the right space and get feedback, and you're just sort of half doing it, you're watching TV, you're doing it, you're just putting in whatever pops into your head, it probably isn't going to have an effect. But if you stay really focused and you're trying to sing, okay, you're trying to look for letter combinations. There's an H in the second spot. And so you go through all of your unused letters in order and you add it and you try to see if that would make sense. And you're very focused. That is probably going to have a better effect. So there's another example of this. Like if you do Sudokus, and if we can get the people to pay more attention by having them ignore a TV that's on, then that's actually going to be a harder activity. So that's one of the things I'll tell people to do is, so you've gotten good at easy Sudoku, do the easy Sudoku, and get your best times. Maybe you average 4 or 5 minutes to complete it. Now do it with the TV news on and avoid that distraction of paying attention to the TV and give yourself the immediate feedback of how long it took you. That's really effective. And so we do that with a lot of people after brain injury, for example, but that would be even more effective. So Wordle might help, but it kind of depends on how you do it.
Any other games or activities? It sounds like maybe learning new things. So obviously maybe reading new topics, not just maybe reading mysteries or things like that, but reading new subject areas. Would that help?
Yeah, it is probably reading new areas. Reading has been correlated with better memory. I haven't seen an intervention study on that, but I think it stands to reason that reading new things, changing the genre a little bit, that would be helpful. And then there are some good products out there. One of my favorite ones right now is called Brain HQ. That was kind of a company that's been around a long time, called Posit Science, but now they're available on apps. So there's a number of good products like that. Usually the subscription service ones are a little better, because one of the things that we have a hard time with when these interventions is we need to have a lot of things to people and be engaged for years, right? The cognitive exercise is a lot like physical exercise. you can't just do physical exercise for a month and say, I'm good for the rest of my life, right? But
Hmm.
people try to do that. I did a 1 month subscription of Brain HQ and now I'm good. Well, no, it doesn't work like that, So the ones that cost a little bit more, they have a larger library of activities, and that seems to be helpful in keeping people engaged over time.
Nice. I'm trying to think what else I have kind of on the list to talk about. We've talked a little bit about diet, memory, those abilities. What about the relationship between mood, anxiety, and memory? For example, is it true that depressed individuals are more likely? I think you mentioned depression earlier, that depressed individuals are more likely to experience memory problems.
Yeah, they are. So both depression and anxiety. It was interesting though. I just thought of this. We were talking about omega 3s. The people that have a depression with a strong anxiety component, in one study, they found those are the people that benefited the most. So there's some research showing that the omega 3 fatty acids might be helpful in some other conditions. It was really effective for helping people with depression, and there's a subtype of depression that has a strong anxiety. So that was interesting. But yes, the depression is really terrible for brain health. Particularly multiple episodes of depression over one's lifetime will put them at increased risk. And then in the moment, if somebody is really struggling with depression, they don't do as well. That's why we actually call it depression. It's literally the depression of the central nervous system's activity levels. That's why we try to increase the neurotransmitter activities associated with activity there. So that can be hard on people as well. Um, but that's once again, physical exercise.
Yeah.
We might be able to improve mood there.
So when we look at getting a start on reducing our risk of dementia as we age, besides choosing our parents wisely, and I appreciated when you said that earlier, because that's one of the things I bring up every term in physiology of exercise. There's a quote from Olaf Astrand, who he says, if you want to be an elite athlete, choose your parents wisely. And of course, I've taken that a step further with the epigenetics and said, maybe you need to be choosing your grandparents wisely. And of course, we can't always choose our parents wisely. We're kind of stuck with what we have. And so we do have a certain level of heredity, but we can also begin very early in life to start to choose the activities that can help us to age well. And so, what can we do early on to minimize our risk of dementia and other cognitive disabilities as we age?
Yeah, I mean, it goes back to a lot of what we had talked about. You want to get people living a healthy lifestyle when they're younger. But we have seen relationships between level of education when somebody is younger and their chance of developing dementia later. That's tough. It's very correlational research. And of course, correlation doesn't equal causation, because the type of person that maybe gets a bachelor's degree or a master's degree, on average, they're on average, they're gonna have a more cognitively stimulated life. But that would be one. Getting the cognitive stimulation. But I would add something else that I think people our generation and younger could look at, is just staying focused. There are so many distractors that, and to kind of multitask with. It's good to be disciplined. I try to teach this to my teenage children that, okay, my daughter was doing this last night. She was studying for driver's ed test, but I could tell she was getting a little distracted and looking at some videos on her phone. And I said, just why don't you just focus on the driver's ed material? Just don't go be looking at TikTok videos while you're doing that. And when you're done studying, then you can go look at your social media. So we need to be more disciplined. People that are just, they're in a meeting, they're looking at their phone, they can't stay focused. I'm concerned for those people, and I'm concerned about that, more of that happening in society, because that's the opposite of doing brain training. That's kind of doing, kind of being weak and undisciplined. But the physical exercise, it's really hard to try to get older adults who have never physically exercised much to really engage with the type of program that could maximally help them. So, having those lifestyles when they're younger, and then controlling the weight and controlling the diabetes, the insulin resistance, all of those things to give yourself a chance later. The one thing we see is the better your executive functioning is as a young adult, the less likely you're going to have a problem later because you have more capacities to lose. So try to really train your brain, push yourself, stay disciplined, and you actually can lose more later in life without having a problem if you have more of those resources developed younger.
Sounds the same as what I say in physical development as well. I mean, we look at bone mineral density. If you have more to lose, and that's why it's important for women to be exercising, doing a lot more weight bearing exercise prior to their first menses, because they build up more bone mineral density, they have more to lose. If you have more muscle mass to lose, you can lose that over the course of time and still be active and still be functioning. So now we're hearing that from a cognitive standpoint, the more we're using our brain early on, the more we're stimulating it and developing it, the more we can lose as we age.
Absolutely, and I think that everything you just described and I described, I think we put it all under the reserve hypothesis, right? The more
Mm-hmm.
reserves you have, the more you'll have later. So I was just talking about cognitive reserve. You were talking about physical reserve, possibly.
So I have all the stuff I've learned over the course of my academics. I have more to forget as I get older, huh?
Yeah, absolutely. It's interesting. I really like how you're making the connection between the cognitive and some of the physical. I got to admit, I like watching the physical exercise research, for example, because it often predicts what's going to happen in the area of cognitive interventions in the future. But for example, you all have known for many decades, even probably before you were a professional, just the importance of cardiovascular exercise and then resistance and weight training. And you all had that figured out 20 years before people came along and said, hey, wait, we actually get improved memory with cardiovascular exercise and an independent improvement if we add the strength training. That was something you all had known for decades. So I really try to follow that because it seems like the cognitive neuroscience is often delayed by a decade or two.
Yeah. Well, in our field too, and I've talked about this often on the podcast. I got into exercise physiology in an era where cardiovascular exercise was the king. I mean, that's what we were pushing. When I got my master's degree, most of my colleagues were going into either corporate fitness or cardiac rehabilitation. There wasn't as much emphasis on strength. And I told my students this a couple of years ago. I went to the American College of Sports Medicine conference, and they were kind of honoring a bunch of the senior fellows in the organization. And I see these older gentlemen walking around. It was mostly gentlemen because that's what the field was. I mean, we've only really more recently had a lot more females kind of getting their PhDs and promoting the exercise. And in a moment, I'll make kind of that difference between the males and the females. But I saw these older gentlemen just walking around all kyphotic, shuffling their feet, walking very slowly. And I'm like, wait a minute, that's not how we should be looking as aging exercise physiologists. We're supposed to be the ones promoting physical activity and exercise. And it just dawned on me that we've been promoting cardiorespiratory exercise and not so much strengthening exercise. Well, if you lose your muscle mass, you can't do as much cardio exercise. And so that activity level is going to decline as you age, and you're still going to tend to lose bone mineral density. You become more kyphotic. You start to shuffle. Sounds like it might even have an impact on cognitive ability as well. And then I looked at some of the senior females in the organization. And these are women who, were really at the forefront of Title IX and sports for women, throughout the eras, and much more upright, much more healthy looking at the same age. And I'm like, I bet they're doing a lot more resistance training and maintaining a different level of physical activity. And so I've been pushing a lot more, especially with my students and on this podcast, that as we age, we need to be shifting our focus a lot more to muscle strengthening exercise, motor development type of exercise, or motor maintenance type of exercises. Because if we can do more, then we're going to be more active. We'll maintain cardiovascular health much more effectively. But it sounds like we'll also be able to maintain our cognitive abilities a bit more because we're maintaining our cardiovascular. You have any thoughts on that?
Well, the research on resistance training and memory is really profound. As I said, it's independent to the benefits you get from cardiovascular. So you get all you can have, because cardiovascular has been shown to, the aerobic exercise has been shown to decrease your chance of developing dementia, but that independent resistance training is huge. So it's a pretty powerful effect too. There were some studies that looked at people who had mild cognitive impairment. So that's a recognized diagnosis. Those people convert at a fairly high rate to dementia. 80% of them will get dementia within 5 years. Every year, about 20% of them convert. And take people with mild cognitive impairment. I mean, it's beginning to affect their quality of life. And we just add in twice a week resistance training. It actually improves their executive functioning. In some cases, bringing them back to normal for their age. And that's all it is, twice a week, 20 minutes resistance training. So that's huge. And I think a lot of times people think, strength training, I need to go to the gym, I need to lift free weights. And, they don't need to do that. If they go to a gym, I mean, there's some wonderful equipment. I'm a big fan of SciFit equipment. It's kind of made for older adults. The pneumatic hydraulic equipment is often good for them. But we can just do it with TheraBands, right? You can get a whole body workout with a few different resistance. So it costs $10. An hour with a trainer, and you're off and running. So it's very accessible to people. We need to be doing more of that.
Yeah. So anything else that you would promote to kind of educate people into what they can be doing now to minimize their risk or delay their potential risk of Alzheimer's or dementia?
Well, I mean, I think we covered it. I mean, if you ask me what I do, I use a standing desk, so I try to get, so I'd like not to sit too much. I always try to get my 10,000 steps, go on long bike rides. There's kind of HIIT training in there, high intensity interval training. We hit the hills, and so you get to, you got a few minutes of just, 80, 90, 95% max. And then hopefully you get a couple minute break on the other side. Right. And then you kick it up again. Be sure to add the weights in, and I've done weights my whole life. I'm doing a lot more, body resistant weights and with yoga now. And then the meditation, there's a whole body of research showing the effects of meditation on improving executive functioning, quality of life, and that's going to decrease the chance of having dementia later. So those are the things top of mind for me.
So those are the things you're doing to age well.
Yeah.
Anything else? Anything dietary? Any recommendations on, we hear people talk about kind of wine and, certain types of like alcohol, like certain beers or, certain other food components that we could be doing to age better.
Well, I think
thoughts on?
Reduce high glycemic food. So we don't want to have the simple carbs. The alcohol stuff, the wine is helpful. The large meta-analyses show that alcohol in general in small amounts might be protective. But you quickly get to moderate drinking, and that it negatively impacts. But you can find research that supports, 1 to 2 drinks a day, depending on body weight. I don't do the wine; it makes my face turn red. So I prefer the IPA there, and then just manage our stress. And the other one that we also haven't talked about much is social engagement. So middle-aged and older adults who are more socially engaged are less likely to have memory problems in the future. So my wife prefers to do more social outings, and so I go along. I made the mistake of telling her about that research, and she'll use it against me. So go out there and engage.
Yeah, I'm gonna make sure my wife doesn't hear that part.
That's right.
So just don't listen to the last few minutes of the podcast, and you'll be okay.
Yeah.
I promote what I call well-centered fitness, which is kind of considering all aspects of wellness as more of a target than a pie, and that we're constantly striving to get closer and closer to that target. And we could be in the bullseye, but you can always get kind of closer to the center of that bullseye. That it gets tighter and tighter as we continue in our growth, planning and so on. And so I consider the spiritual, and that being more considering yourself as, not the center of the universe, but a contributing part to the universe, and that everything that you do impacts others, and focusing in on more universal purpose in life and that kind of stuff. The physical, we've obviously talked a lot about that, and that's my field of study. The intellectual, continuing to learn and to stress and adapt the brain, emotional, and in the social. And I always tend to think that the spiritual and the physical lend themselves to the other components. That until you have that strong spiritual physical balance, it's a lot harder to really focus on your intellectual, certainly on the emotional, and then the social is kind of at a pinnacle of that. And so we do try and stress that a lot on this podcast, not only just the physical or the kind of the intellectual part of it all, but getting that well-roundedness to help with aging. I promote, journaling on a daily basis, I think is very important. It's one of the things that I do to hopefully age well. Obviously the exercise, and I agree wholeheartedly with you about the nature of the exercise doesn't necessarily matter. I mean, how much, it's just that you're doing it regularly and you're getting a significant enough dose to offset the decline that we might be seeing, that we can get more from less in many regards. We don't have to do an hour, 2 hour a day at the gym. We can just simply do even 15 minutes here and there, but the frequency and the regularity of the exercise and kind of covering all aspects of human performance, whether it's cognitive, whether it's physical or whatever, it's social, whatever it might be, we're improving ourselves. And each of those things are contributing to aging well. So.
I agree. And the research supports that from, kind of the field of cognitive neuroscience. So it's been a real pleasure chatting about this and finding the connections today.
Yeah, I appreciate you being on here. Might have to have you on again sometime, as we probably will have a conversation and it'll trigger, oh, we didn't talk about this. And we can always bring that back. And I appreciate having colleagues like yourself and the others in your department. I mean, I guess you're not quite as much in the psychology, gerontology department per se. I mean, your colleagues now are everybody, since you're our provost. But appreciate, the interactions we've had and the opportunity to kind of to grow more. And I look forward to hearing more from you as we both age well.
All right. That sounds great. Thank you.
Thank you for listening. I hope you benefited from today's podcast. And until next time, keep aging well.